Okay, good evening, everybody, and welcome to Pharmacology. We're going to be learning in this course what does the drug do to the body and what does the body do to the drug. My name is Rod Kadir. I will be your professor guiding you throughout this course. This course requires a lot of critical thinking and analysis, and we're going to be going through the chemical structures of the medications. What are the ramifications of taking this medication to a patient who has um, a pre-existing chronic disease? We're going to be looking and surveying how does a medication affect children, pediatrics versus the elderly, the geriatrics versus the young adults and the adolescents. We're going to be looking at what are the differences between um, subjects like male versus female. We're going to be looking at obesity versus malnutrition. Does that really affect the pharmacodynamics and pharmacokinetics of these pharmacological interventions? We're going to be also examining how does how does the medication restore homeostasis. We also have to have an excellent understanding of what is stress, because this is what the pharmacological intervention is all about. Countering, countering the stress, restoring the built-in mechanisms in your body that will restore homeostasis. How could this xenobiotic, xeno, that's foreigner. They say xenophobia. Xenophobia is the fear of those who are different. So we have xenobiotics. Biotic means in the living system, in the bodily systems. Xeno means it's a foreigner. So your drug, your medication, that's an example of a xenobiotic. It is not part of the body. This ibuprofen, this is not part of the body, was never made by the liver, was not made by the kidneys, yet it is hosted in the body. So it's a foreigner that makes its way in the body, gets absorbed into the body, gets disseminated and distributed in the body, gets metabolized by the body, and then gets excreted out of the body. So here we're going to be looking at these xenobiotics. And then we're going to learn that xenobiotics are not always, positive. They're not always medications. Asbestos, that's an example of a xenobiotic. That's a dangerous, toxic substance that is in your external environment, but it goes through your nasal cavity and your oral cavity, and then it makes its way to your lungs and then right through to your pulmonary circulation. So it's a xenobiotic also. So we're going to be examining these different different substances that are not part of the body, yet they have to be accommodated by the body. We also going to be examining human exposure to pollutants in industrial societies. So this is a very important concept that we're going to learn, that most of the pathologies that we are developing these pharmacological interventions for, they are caused by industrial society, ranging from vitamin D deficiency, because we are working in industrial societies in the office all day, no sunlight. Then that causes a problem because ultraviolet radiation is required for the genesis and the making of the vitamin D. So you can drink all the milk you can, but this milk is going right out from where it entered because it's not getting absorbed. It's not getting absorbed because there is vitamin D deficiency. So now we're also going to be examining these social, ramifications of how our own technological industrial society is behind many of the diseases that those who lived here before us never had to deal with. And we also have to have an excellent understanding of what is disease, what is stress, what is cell death, what is cell necrosis, what is acute inflammation, and what is chronic inflammation. Because all of these pharmacological interventions are working to support your bodily system to overcome the stress, to overcome cell injury, to overcome cell death, to overcome necrosis, overcome acute inflammation, overcome chronic inflammation, reverse the heat that accompanies the inflammation, reverse the swelling that comes with the inflammation, the redness that comes with this inflammation, the antihistamines, that choke your blood vessels to cause a vascular spasm. So you take an antihistamine. We're going to be learning about how that is going to be, how are these antihistamines come in effect to relieve this state of inflammation. So before we do that, we have to have an excellent understanding of what is a xenobiotic, what is a drug. And I was talking to your classmates in the earlier section that there was an excellent definition of what is a toxin, what is a poison. And this definition was put together by a philosopher, a Greek philosopher, thousands of years ago. And it's very interesting because it's still true today, even though thousands of years passed. And his definition of what a toxin or what a poison is, that is so interesting and still holds to be true up to this day, was that he said that a toxin and a poison is only different from a remedy based on the dosage. So anything, if you take too much of it, it becomes a poison. Too little of it, it becomes a poison. So who would have imagined that water, too much water, is going to become a toxin or a poison? Intoxication, water intoxication. So if you kind of heard in the video that these marathon athletes, they are very hot and dehydrated and exhausted. So when they cross the finish line, they drink so much, water. And when they drink so much water, what happens? They dilute the blood. So the blood proportions of these solutes and the pH and these salts start to get disrupted. They start to get diluted, which causes increase in blood volume, which causes hypervolemia, which causes cardiac output to go up, which causes contractility to go up, which increases heart rate, which increases the tension in the heart, hypertension. So something from water, which is a remedy, healthy water, then it became a disease, it became a toxin, it became a poison because the dosage was too much. So his initial definition is actually very true. Ibuprofen, 800 milligrams of ibuprofen is excellent. 8,000 milligrams, 2,000 milligrams. Now that's going to become intoxication. So it is the dosage, the appropriate amount of this remedy is what's gonna distinguish if this will be a medication or if it's gonna become a poison. So we're really going to be concerned about what is the the definition of a dosage. And obviously, if there is an infection, a microbial infection, parasitic infection, if there is bacterial infection, viral infection, or a fungal infection to a pediatric versus a geriatric, obviously I'm going to be giving them antibiotic, but am I going to be giving them the same dose to the pediatric and to the geriatric and to the adult? Am I going to be giving the same dose to the malnutrition and the obese patient and the normal weight patient? Am I going to be giving the same dose for males and females? Am I going to be giving the same dose to pregnant mothers and lactating, who are breastfeed, mothers who are breastfeeding. So these are all very important factors that we take into account in determining the dosage, because the dosage is the criterion into whether we're going to have a remedy, a medication, a pharmacological helpful intervention, or it's the double-edged sword. This dosage is the most important thing in the pharmacology, is how can we decipher the appropriate dosage, because this dosage can turn my medicine from a remedy into a toxin, into a poison. So that is very important. So and also we're going to be learning that this drug, many people and many students, they think drugs are all for treatment. No, many drugs have nothing to do with treatment. There are drugs for diagnosis. There are drugs for prevention, like a vaccine. Is the vaccine not a... Yes, hi. Are you in this class? Yeah, you can come in, yeah, please. Pharmacology, LPN? Okay, yeah, sure. Please come in. Are there seats? Yeah, there's a lot of seats here. So, yeah, you're welcome. So, not every pharmacological intervention, not every medication is for treatment. Vaccine. Is a vaccine not a drug? Is a vaccine not a drug? Vaccine is a drug, but does it treat anything? It's prevent. So there is drugs for prevention. Drugs are there. Drugs, medications, pharmacological interventions. Although we assume, and it's true, the vast majority of the pharmacological interventions and the medications are there for treatment, for treatment, treatment. But they're not all for treatment. You have drugs and medications for prevention, prevention. You have other drugs and medications for diagnosis, and diagnosis is to diagnose a disease, and diagnostic are to find out. So there's this very important experiment that you need to know really well, was that back in the day, scientists wanted to know, how does the brain work? This brain, this 1.5 kilogram of pudding that we have, our brain, with all these sulci, they wanted to see, how does it work. So they brought a test subject, they brought a person, and they gave the volunteer glucose. You know, your brain loves glucose. Nobody loves glucose in the tissues of your body more than your brain. I mean, your brain doesn't even have glucose transporters, the GLUTs, GLUTs. Remember, if you took anatomy and physiology, you know that glucose enters the cells through glucose transporters. For the neurons, for your brain, it doesn't even need those. It just flows right in like water. That's how important glucose is to the brain. And during times of starvation, the rest of your bodily tissues will give precedence to your brain. So if there is any glucose that's left over during famine or poverty, the rest of your body will not take it and will let glucose flow right up to the central nervous system in your brain. And the rest of the body will start sharing proteins and lipids and nucleic acids and the rest of the macromolecules for metabolism. But glucose is left for your brain. So what they did was they added this drug, and the drug was radioactive drug, meaning it will shine. This radioactive drug, it will shine whenever glucose is consumed. So they tag glucose, with a radioactive drug, and this radioactive drug will shine. And they put a helmet on the head of this test volunteer, and they told the test volunteer to start eating a sandwich, or maybe look at pictures of meals. And then they saw a certain region of the brain light up. When that region lit up, the scientists immediately observed that this is the region in the brain responsible for regulating appetite, because nowhere else in the brain lit up except that region, indicating that glucose is being utilized. Glucose is the fuel, the gas to make the cells work. So they said, oh, so that region in the cortex is responsible for the regulation of appetite. Then they told the test subject to start walking on the treadmill. Then another region lit up. So they said, oh, so now we observe that glucose was tagged with this diagnostic pharmacological agent, this drug, and it helped us understand that this separate region lit up when we are walking. So that region is responsible for coordinated movement and locomotion. Then they told the patient to look at some sexually arousing, seductive, that will make the test subject sexually stimulated. Then another region lit up. So then they discovered, oh, based on this observation, that this separate region in the brain now lit up with this radioactive drug. And then we now realize that this is the region that regulates sexual reproduction and sexual stimulation. So here, that had nothing to do with treatment. We didn't treat anything. Here we used this pharmacological intervention not for prevention, not for treatment, but rather for diagnostic and diagnosis. So we're going to learn that drugs have a varied variety of purposes, contrary to public misinformation, assuming that drugs are just there to treat you. They can do many significant, important things. It's also important for us to understand what is pharmacology, to put in perspective what are we studying, what are we going to be going through this semester. So pharmacology comes from the Greek word. You see all Greek. They did an excellent job from back in the day. So pharmakon comes from the Greek word pharmakon, which means a drug or remedy. And ology, obviously, psychology, pathology, physiology. Ology means the study of. So it's the study of drugs. You must also understand that every science out there. So, in order for us to narrow down what is this science that we are learning, this is not anatomy and physiology. We're not going to be studying the structure and the function of the bodily systems. We're not going to be studying the pathologies. We will allude to those 30%, but the 70% we're going to be studying how the body affects the drug, meaning how does the body receive and host this drug? How does the body distribute the drug? How does the body metabolize the drug? What is the mechanism of action of the drug? And how does the body excrete and remove this drug? Because once it does its job, we want the medication out of there. Otherwise, it's going to build up in your bone. The medication is going to build up in your lipid tissues, and it's going to cause some severe diseases, even though it went in there to help you. But if you don't excrete it, it's going to cause dangerous diseases. And we're going to also be learning about the importance of the liver when it comes to pharmacology and comes to medications and pharmacological agents being metabolized. It is your liver That's why alcoholic liver disease, cirrhotic liver disease patients, they cannot, even though the medication would enter the body fine, will do its job fine, but cannot be eliminated, cannot be excreted in the urine as it should, cannot be excreted in the fecal matter as it should, because it is your liver. The liver is the main processor. The liver is the main integrator. The liver is the main control that gets rid of these medications right after we take them. So it's very important for us, as the first step, is to see where exactly is this pharmacology is going to stand. So that's going to help you what to focus on when you're reading the book and when you're preparing for your exam, because there's a lot of information there. You don't want to drown in the information. You have to have a GPS and say, okay, this is the science that we are investigating. What should I focus on? In anatomy and physiology, we focus on structure and function. Pathology, we focus on the ailments. Here we focus on two things. What does the body do to the drug? Hosting it, distributing it, eliminating it, metabolizing it, excreting it, and the opposite. What does the drug do to the body? So now let us now see where exactly does pharmacology stand. So when we begin so generally when we define science, what is science? Science is the study of the knowledge and truth of a particular phenomenon. And obviously there are many different sciences. There is the sciences of the living things. These are known as the life sciences. So you have the life sciences. These life sciences, an example of that would be your biology. Biology is an example of life sciences, studying the living things, the living things, the organisms. You have to be alive, the plants, the animals, the humans, the animals. But you have to be alive to be part of the life sciences. Then you have the non-living, the study of the non-living. What do we call that? These are the physical sciences. Physical sciences. These are astronomy, archaeology, fossil fuel, geography. This is chemistry, crude chemistry. So this is non-living. Then you have behavioral and social sciences. These are the sciences that study the behavior. And what is behavior? We're going to see this in psychiatric medications. And behavior is when we study the incentives, the rewards and the intensives, plus, the incentive, the plus, the thing that is rewarding, as well as the punishment or the penalty. The punishment and the penalty. So what regulates human behavior? Why do people do the things that they do? Why are you here today and why am I here today? There are always short-term incentives and rewards, and there are long-term incentives and rewards. There is long-term incentives and rewards, and there are short-term incentives and rewards. There are long-term punishment and penalties, and there are short-term punishments and penalties. Long-term incentive is you're gonna fulfill your life calling and become a nurse and help those who are ill and needy and need your help, and you're gonna have like a an enriching um and you're gonna be having like you're gonna have a feeling of purpose. So that's a long term. A short term, you're gonna get credit for showing up, and you're gonna get attendance points, and you're gonna get closer to an A. So all of that, short term and long term incentive. For me, I show up. Long term incentive, I'm fulfilling my life purpose of teaching and learning. And short term, maybe, paycheck, all that kind of stuff. Then punishment, if I don't show up long term, then I'm not fulfilling my job. I'm going to be having no purpose in life. I'm going to feel the depression, the anxiety, the low self esteem. And the short term is I'm not going to be able to pay my bills. I'm not, that kind of stuff. So always people behave based on two things: plus and a minus, reward and punishment, incentive, reward, or punishment and penalties. So behavioral sciences study the behavior of individuals and the behavior of societies. You see, we operate based on individual levels and based on communities. Some communities behave differerly. The affluent communities, the rich people, they don't act the same way as the impoverished, socioeconomically disadvantaged population. You know that. Also, the individuals, an affluent individual and an affluent society would act differently than a socioeconomically disadvantaged individual and a socioeconomically disadvantaged community. So that's how we study the behavioral sciences. But in the end, all these sciences, all the sciences, and by the way, there's a hybrid, hybrid mix up, hybrid. There is hybrid sciences. So it's not like you're only this or that. There is no gray area. You're only life science or physical science or behavioral science. That could not be any more not true. That is very untrue that you can only be one type of science. There's a mixture. You mix things up. So like a hybrid. You have biophysics. You see, biophysics. So biophysics, that's a hybrid. That's a mixture between living sciences and the sciences of the non-living. So that's an example of a science also. Hybrid sciences. We mix them up together. But in the end, doesn't matter what kind of science, all these sciences are classified based on two classifications. There's basic sciences and applied sciences. There is basic science and there is applied sciences. Basic science and applied science. So there is basic biophysics science and there is applied biophysics science. There is basic social science, there is basic social science, and there is applied social science. There is basic physical sciences, basic astronomy and applied astronomy. So no matter what the science is, there's always two branches: basic biology, basic life sciences, and applied life sciences. So what's the difference between basic and applied? So somebody who's approaching the science from a basic standpoint is different from someone who's approaching the same science from application or applied standpoint. And the difference is not in the abstract. The difference is in the objective. So why am I studying the science? One will say, I want to study the science based on a basic objective, meaning I want to learn. I want to learn more and more. So basic science is always about foundations. Basic science is always about foundations, always about fundamentals, fundamentals, always about in-depth knowledge, is always about in-depth knowledge, about fundamentals, about foundations, learning to learn, to accrue more information, to accrue more information, to have a bank, information bank, to have an information bank. That's somebody like me, a professor, teaching, learning more and more, reading different pharmacology books to explain the same topic so you can have a different understanding, a multi-dimensional understanding, an in-depth knowledge, a foundational, basic knowledge. But for you guys, it's not going to be a basic science. It's going to be an applied science, and that is how to apply this knowledge that you learn. So we study engineering to make technology. We study pharmacology to practice the nursing. So you're going to apply the knowledge. Installing a catheter, that's an application of the knowledge you learn. I'm never going to be applying a catheter. I'm never going to be giving an injection because I'm here. I'm in the basic sciences. I'm learning to learn and accrue more information. But you're going to take the knowledge and you're not going to learn more and more and more. No, you're going to take the knowledge and apply it. So all of these sciences, they are approached from two standpoints, either from a basic science perspective, learning more, getting more ideas, and from an application standpoint, and that is to take the information and devise and invent. So applied science is all about invention, is all about finding solutions to real world problems, finding the cure for cancer, finding the cure for COVID. Now that's application. You're applying, you're solving. So the key concept here is that application is to find a real world solution to a problem. So pharmacology is obviously a science, so we're going to approach it from both perspectives. We're going to learn the basic, fundamental, foundational, key concepts, in-depth knowledge. Then we're going to learn how we're going to apply this knowledge to make this drug, this pharmacological intervention, so we can achieve treatment, so we can achieve prevention, so we can achieve diagnosis, so we can achieve diagnostics. So they're not enemies. The basic science and the applied science, they are not enemies. So they work together. They feed into one another. So we can never have applied science unless we had a good bank of information to lead us into which direction. And then we're never going to have basic science if it wasn't for the applied sciences that help develop this basic science. And in your book, they also recognize the importance of serendipity. Serendipity. So serendipity is when it was unexpected. You will see that many applied sciences and basic sciences, we have learned things that they were unexpected, like Alexander Fleming. Does anybody know what did Alexander Fleming do? I'm sorry, raise your hand, please. Yeah, antibiotic, excellent. So do you know what's the name of the antibiotic? Yeah, penicillin. Excellent. So what happened was, do you know how he discovered the penicillin? So this pharmacological agent, this drug, this penicillin, this antibiotic. So penicillin was discovered by serendipity, by accident. So he left a petri dish full of staphylococcus bacteria on the bench top, and he forgot to cover it. Right next to it was a fungal colony. So he came the next day, he saw that the fungal colony killed all the bacteria. So he was very surprised. How did that happen? How did the fungus kill the bacteria? I thought they are different. Fungus is different from the bacteria. Bacteria is different from the virus. Virus is different from the worm. So how did that happen? So he realized that the fungus is able to secrete antibiotics that kill the bacteria. And that particular fungal colony was the one that made the penicillin. So the fungal colony secreted penicillin, and penicillin killed the staphylococcal bacteria. So then that's how they were able to cure infected wounds back in the day. So they would bring molded bread, rotten bread, and they would tie it around the wound with pus, and the wound would cure. So how did that happen? The same way with penicillin, the antibiotics of the fungus would kill the bacteria. So when you put a rotten bread on a wound, obviously they don't do that anymore because we have excellent antibiotics. But this wasn't that far back. You can find videos on YouTube in the 1960s and 50s of nurses being taught how to make these um, dressings with molded bread, and it was very effective. So the molded, because the molded bread that is that has this fungal colony, this fungal colony is secreting antibiotics because they are so selfish. The fungus want to be there, only fungus, no bacteria. The bacteria is secreting exotoxin, endotoxin to kill the fungus. The fungus is secreting antibiotics to kill the bacteria. They do not coexist. They don't want to live together. So one want to kill the other. So the fungus would secrete the antibiotic in the wound, and the antibiotic would kill this this bacteria. So we will see that there is historical development, but you will see that this serendipity is very, very important. It was unexpected, was not in mind. Sometimes in life, when you go in different directions, good things happen to you. When if you have one path that you're following, you're not willing to change it, you're not willing to take different directions in life, nothing good, serendipity will not happen to you. We're not saying that you should not be focused and all about exploring different things. That's going to be waste of time. But most of the time, you are sticking to one path, but you must have room to explore new directions. So you open the way, like to what happens, because if you are fixed, you're so fixed into one path, you're not going to be allowing any good opportunities to come to your way. So you will see that many pharmacological interventions were developed with serendipity, by unexpected things. So also a couple of very important concepts that we are going to go over in the slides is we're going to see that our medications are always trying to restore state, always trying to restore homeostasis. So usually we are in homeostasis due to the success of the built-in systems that are in our body. These built-in systems are able to restore and maintain homeostasis. And we're never gonna have a good understanding of what homeostasis and how does pharmacology always striving to maintain, achieve and maintain. So we don't just want to achieve a homeostasis and we are done. We want to achieve homeostasis and we want to maintain homeostasis. So we also have to have an excellent understanding of what is homeostasis, and we're never going to have a healthy or excellent understanding of what's homeostasis unless we have an understanding of two environments fighting: the external environment and the internal environment. So we have external environment, and we have internal environment. So the external environment is everything outside the body. The internal environment is the bodily system. That is the bodily system where the drug is going to be taken, the bodily system. So the external environment is always feeding stress, 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 different kinds of stress. There is physical stress, there is chemical stress, physical stress, microbial, microbial stress, mechanical, mechanical or traumatic stress. So these are different kinds of stress. We're never going to, yes. Yeah, I'm recording that for you. But we're gonna go over the slides. Yeah, we're gonna go over the slides. Everything is on the slides. So this is just a background information so that when we go on the slide and we do like a round two, now everything now ties back to what we are saying. And don't worry, for the exam, I'm gonna give you a study guide. So this study guide, yeah, so this study guide is gonna help you. Yeah. Okay. You, yeah. So I'm still discussing with the dean and the administration, like how exactly they are going to be demonstrate. How are we going to do these exams? How are we going to execute them? But for now, we're just go. I'm going to tell you that you're never going to be taking an exam where you just tested and your critical thinking and your. I'm not here to test your intelligence or trick you. I'm going to give you like a study guide. Like if you do the study guide, so you have been worried about the exam all this time. So you didn't learn anything. Okay. What is it? Okay, no, no, no. You see me, I'm gonna make a path for you. If you do the work, not only you will pass, you will get A's. All my students get A's. So so it's very simple. Okay. I will do that. Yeah. Kadir, I will tell I didn't say my name. Okay. I didn't even say I said my name in the beginning. Yeah, I did. Yeah, I did. I did. I said my name is Professor Rod Kadir. Yeah, I did. Okay. Anyways, as far as exam, so now you can focus on learning, which is the most important thing. Okay. Exam wise, you will never be tested except that I give you a study guide that is 1 for 1. Like for example, the exam is going to be 60 questions. I'm going to give you 60-question study guide. So you're going to go home and you're going to answer all these questions and you're gonna submit it, upload it online, and you're gonna see that on the exam it's really similar. And there is and there is also multiple choice. Sometimes I recycle these questions from the multiple choice. So when you do, so we know many students, they are on, we know about all of this group chat and taking a photo of the question with the answer and sending it in the group chat. But then when you see the same question again on the exam, some students still get it wrong. So they get 100 on the homework, the 25 question homework, and which is worth 10%. But on the exam, the same question, they get it wrong. So you have to study that question. You have to study the multiple choice question. You have to understand why is each right answer the right answer, and why is each wrong answer the wrong answer, because the question is going to be very similar to the study guide, very similar to those multiple choice questions. It's just a rewording or around the same concept. So we're not going to be all over the place. And there's, you see the video I made for you, the video that when you walked in, me talking about the xenobiotics and the different routes of entry. So I'm going to put for you a video link. You're going to click on that video link and at your time, because I know it's like 5 p.m. now, the brain is shut down. I know that. So you're gonna go and click on that video link and listen to this video of me explaining a topic. And you're gonna summarize the key concepts of that video. What have you learned? And the major concepts that I discussed. And you're also gonna upload that for credit. So the three things: homework, multiple choice, study guides for the exam that you have to solve and upload, and the summary, the video, the YouTube videos, and you will see that your exam very, very, very like 100% copy of the summaries, and copy of the study guide and your homework questions. So it's really not all over the place. And you showing up and paying attention, that's going to help you a lot with preparing for the exams, because some questions that I'm going to ask is something that I mentioned in the lecture. So don't think that I'm gonna be like making it difficult for you. If you just do your assignments and you do your work, you will see that it is like a path to an A. I like to give most of my student A's, but you have to do your part. I do my part, you have to do your part. Okay? Yeah, I just started here. Okay? I'm sorry? Okay, so now this logistics of the exam and all of that, we will sort that later. Now the most important thing for me is the learning. We have to get the material, we have to have a good impression of the objectives of the course, of the content, and then I'm going to make an announcement for you on Brightspace with what is the homework, when is it due, when is the study guide due, what is the study guide, when is the exam, the summary videos, and these kind of things we're going to be sorting out on the LMS platform. But for now, it's very important for us to, just be concentrating on learning and absorbing the information, because this course is heavy, is a lot of information. And in ATI, they're gonna have some questions that I don't even make. For the most part, the ones that I make the questions, you guys gonna get study guide for. But I have to cover everything, because behind my back they're gonna be making some questions I didn't make. So I have to cover everything, because they're gonna hit you from somewhere I did not cover, and then you're not gonna do well on that part. So I want to make sure we cover everything. Okay? So, this is not the kind of course where you just show up one day and you just pay, you expect that I teach you everything, and you go home and you have nothing to do with the course until we meet next week. That is a recipe for failure. I promise you. If you do that kind of thing, you just show up today, Thursday, 5 to 9:30, and then you go disappear, and then you just show up next week, Thursday, and you expect to pass, I promise you that will not happen. You have to develop a relationship with the course, a daily relationship of going over the study guide questions, going over the lecture slides and these videos, and reviewing and reading the book, and building up the confidence, building up the critical skills and your analytical skills, and you will see that you will do it. I'm trying my best to build for you guys the best course. So you just concentrate on doing your best and investing in your learning, because this course is what's going to help you the most with your clinicals and with passing the 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 NCLEX, and doing well, and even advancing your career, your profession in the future, moving on as an LPN, moving upward on the ladder. So it's very important that you take this course really seriously, faithfully, and you don't just look at the course. No problem. You just look at the course that this is just a hurdle for me to get across. I mean, I just cannot wait for this course to be over, and it's just in getting in my way of me getting my degree so I can go get a job and get a paycheck. This is not the attitude that or the thinking that is going to be productive. So you need to believe that this course is here for you to build your critical thinking. You need this course. So you need to spend time on it, reading and preparing and developing yourself, and you will see that not just you will pass. If you're worried about passing, you will get an A. Okay, so this is what I'm trying to do. So work with me. I see you. So you will see I always do my best. So I expect nothing but the best from all of you. So you work hard, and you will see that We are on the same boat. I work hard, you work hard, and then we all do well. Okay, so don't let the thinking of the exam hold you back from paying attention to and learning. Okay, okay, yeah. I heard that from the other class too. They said that. Yeah, yeah, yeah. They told me. Yeah, they said that the course they told you guys you're adult, you gotta learn on your own and all that kind of stuff. No, so you see, I like to explain a lot, so you will see that many of the concepts I'm going to be explaining them for you. So now you're gonna build up on what I teach. Then you're gonna go home. Everything is gonna fall in place. So I've explained first, then I go over the slides. Then that's 2/3. The last third. So I do 2/3. All you got to do is go home and do the last third, reviewing and doing the assignments and doing your part, and you will see my 2/3 plus one third of you'll do excellent. So yeah, so don't whatever happened in the past, just leave it behind. We don't want to waste any time. We want to make sure that we make the most out of this course. We develop well, and then we move forward. Okay, I forgot what I was talking about now. Okay, stress. So we're doing pharmacology, right? This drugs. Pharmacology is what the drug does to the body, what the body does to the drug. It's the two-way relationship. How does the drug affect the body? How does the drug exert its mechanism of action? And how does the body respond and host and deal with this drug? But the drug, we're not gonna know about it unless we understand stress. Then after stress, we're gonna move to injury. Then after injury, we're gonna move to cell death. Then after cell death, we're gonna move to necrosis. Then after necrosis, then we're gonna move to inflammation. Then from inflammation, we're gonna move to this, fibrosis, and how do the medications help us restore homeostasis. So we're not gonna just be memorizing these drugs, because what's gonna help you memorize these medications is to understand where they're gonna fall into. So the first concept of interest is stress. What is stress? Well, we did give examples of what stress is. Mechanical stress, RTA. What's RTA? Road traffic accident. That's an example of a mechanical stress. You have an open fracture, a bone is broken, rupturing the muscle around it, rupturing the blood vessels around it, cutting the skin, bone coming out the skin. That's an open fracture. That's an example of a mechanical fracture. Then you have mechanical stress. Then you have microbial stress. There is no road traffic accident here. There is a microorganism, a bacteria, a virus, a worm, a parasite, a fungus, and that's going to affect your body in a stressful manner. Then you have physical stress. Physical stress is temperature. Too hot, hyperthermia. Too cold, hypothermia. Then you have chemical stress, detergents, corrosive agents, too much sugar, hyperglycemia, too little sugar, hypocalcemia, too much oxygen, hyperoxemia, too little oxygen, hypoxemia. So the condition is not just no problem. The condition is not just the more the better. The more oxygen, the better. Oxygen. Oxygen is good. We breathe oxygen. We love oxygen. The more oxygen, the better. No. There has to be a set range of oxygen. Okay? So the stress always comes in the form of hyper and hypo. Hyper and hypo. Hyper stress and hypo stress. Hypercalcemia, hypocalcemia. Hyperglycemia, hypoglycemia. Hyperthermia, hypothermia. Phosphatemia, hypophosphatemia. Hypertension, hypotension. We don't want either. We don't want hyper or hypo. We want U. We want eutension. We don't want hypertension. We don't want hypotension. We want eutension. We don't want hypervolemia. We don't want hypovolemia. We want euvolemia. We don't want hyperglycemia. We don't want hypoglycemia. We want euglycemia. We don't want hyperphosphatemia. We don't want hypophosphatemia. We want euphosphatemia. So this state of U represents your homeostasis. So your pharmacological intervention is trying to, if you go up to hyper, brings you down to U. And if you go down to hypo, it brings you up to U. So there are different systems, different feedback loops. So when we're talking about pharmacological intervention, we're talking about negative feedback. So we're going to negative feedback to restore. We're going to negative feedback to restore homeostasis. So each medication is either bringing things up or bringing things down to the U state. So I just gave examples of stress. We still didn't define it yet. We gave examples of it. We gave physical stress example, microbial stress example, chemical stress example, mechanical stress example, but we didn't define what stress is. So is stress good or bad? Well, not all stress is bad. We need moderate stress. You know, this exercise, that's an example of a positive, moderate stress that promotes health and well-being and quality of life. But hyper stress, burnout, that's not good. Hypo stress, just chilling and hanging out and doing nothing, waking up anytime you want, just walking around with no purpose in life. That is the major cause for low self-esteem, low self-image, anxiety, depression. So you need to have a purpose in life that you work toward to fulfill. For that, you need moderate developmental stress. So stress is not always negative. It's too much stress that's negative, and too little stress is also as bad. So stress, now there is this entire stress pathology. It's the science of stress. And the father of that field, we will see in pharmacology, his name was Cellier. So Cellier is the father of stress. And Cellier discovered by serendipity. Again, serendipity strikes again by chance. He brought different rats, assuming that's a rat. Let's say different rats. So this is rat 1, 2, 3, 4, 5. These are 5 rats. These 5 rats, he injected each one with high dosage of a different hormone. You see, high dosage. What did our Greek philosopher friend say? High dosage of something is what? Yeah, now it becomes a poison, a toxic. So that's an example of a stress. He gave, insulin is good, but he gave too much insulin, too much thyroid hormone, too much insulin, too much thyroid hormone, too much estrogen, too much testosterone, too much. Then he put some of them in really high temperature, not really high to die, but really stressful hyperthermia, simulate stressful physical agent. So he put them in an oven, hyperthermia, but they didn't die, but they really suffered badly. And then he put others in the fridge, hypothermia. But in the end, 1, 2, 3, 4, 5, they had different kinds of what? Stress. Then he realized, even though all these different rats had a different source of stress, They ended up with the same thing. What did they end up with? Even though they were five different subjects receiving different sources of stress, they had the same thing. What was the same thing that they had? They had an ulcer. They had a stomach ulcer. So now, if a patient comes in the hospital complaining of stomach pain, and then they do an endoscopy, and then they see that there's a stomach ulcer, a fissure. So they say, oh, it's H. pylori infection. Most likely is. So now they bring the urea breath test bag. They tell the patient, blow air into this bag. Then they take the bag into the lab. They look in the bag. There is no H. pylori, but he still has stress. Obviously, the H. pylori will secrete a lot of endotoxin and exotoxin that will cut and make a fissure and an ulcer in your stomach. But that patient did not have it. So that's a stress ulcer. So that patient is so stressed out in life, living in some sort of abusive, very dangerous, having some form of substance abuse or drug dependence, or some domestic type of dangerous living condition. So the stress is so much, they start to develop stomach ulcers like these rats. So that shows you they had different types of stressors, but they had the same outcome, which is this stomach ulcer, the stomach fissure, stomach ulcer or the stomach fissure. So the stress is the first step into the disease formation. So stress is the first step in the disease formation. You're never gonna have, the fire in California. So that fire did not begin with the volcano. It began with a spark. So that's how we begin with stress, stress. Then after stress, we go to cell injury. The cell is now injured. Then after cell injury, we have damage. There is a line, a specific line. Once you cross that line, you never come back. It's called the damage beyond salvage. The damage beyond salvage. This damage beyond salvage means the damage too much to repair. There is nothing to fix. Is the damage is too severe. So if you cross this line, it's like death. When you die, you don't come back. So in damage beyond salvage, the cell is injured, but is injured beyond healing. Damaged beyond salvage. So now you're going to have cell death. You're going to have cell death. When the cell dies, it can either die in a good way, plus, that is positive death, known as apoptosis. Apoptosis. In apoptosis, the cell is going to break into harmless, edible blebs. So now the cell is going to start breaking into bubbles, into balloons that your body can easily dispose of and get rid of in a easy way, like that. So it's going to break into harmless, edible blebs. You know, when there is a nuclear plant spill, when the nuclear plant spills, it's going to damage the nearby surrounding the neighborhood. So your bodily tissues are made up. So you guys now are like a tissue, but you're separated by the chairs. Your cell is like an auditorium where you touch, like the subway, you're touching each other. So the cells, in fact, the cells are hooked, they are stapled together with these cams. The cams, CAM. CAMs. So the CAMs, these are the cell adhesion molecules. The cell adhesion molecules. These staple the cells together. The cell adhesion molecules hook the cells together. In fact, there's a disease. Anybody heard of Duchenne muscular dystrophy? Nobody heard of Duchenne's muscular dystrophy? You guys took pathophysiology? Okay. So in Duchenne's muscular dystrophy, there is a genetic problem where these that staple the cells together, hook them so close to one another, is defected. So now there's the connective tissue damage, and the skeletal muscle system, the integrity and the structure of the skeletal muscle system, it gets weaker because the cells are not tightly hooked together. So if the cell dies, and the cell does not die by apoptosis, what's gonna happen is not gonna break into small, edible, harmless blebs. What's gonna happen is the cell membrane is gonna rupture. When the cell membrane rupture, the lysosomal enzymes start to spill out. The lysosomal enzymes spill out and they damage the nearby tissue. So inside the cell, there's a lot of weapons. There is lysosomal enzymes. There is lysosomal enzymes. There is proteolytic enzymes. There is degradative enzymes. There's acid. There is reactive, oxidative species. All these are weapons that your cell uses to fight the bacteria, but they have to be localized. But when the cell dies, not with apoptosis, they spill. That's known as necrosis. Minus. That's necrosis. So necrosis is when the plasma membrane fracture. When the plasma membrane fractures and all of the lysosomal, degradative, proteolytic, acid, and reactive oxidative species spill out. So now imagine with simply as, God forbid, somebody now they have some form of a rupture and all the blood starts spilling out in the auditorium. So is gonna be sprayed over everybody who's next to that person. The same thing, the cell. If the plasma membrane breaks open, all of the lysosomal enzymes, the degradative enzymes, these are dangerous weapons. These were made to fight the bacteria. Now they're all gonna spill to the nearby tissue, damaging the nearby tissue. So that is known as necrosis. Otherwise, we don't die by necrosis. We die in a very nice manner by the cell making these bubbles, these blebs, these harmless, edible blebs, and then the body will get rid of them. And these edible blebs are removed, and in the place where that cell was who died, a new cell is going to start to regenerate. So we're going to start to build new cells in place of the ones that were damaged. In necrosis, no time for that. Like I say, ain't nobody got time for that. It happens so quick because the stress was three things. The onset of the stress. We have stress that happens suddenly, rapidly, and then we have gradual onset, and that is slow. We like slow and gradual onset of stress. But if the onset of it was so sudden, lightning bolt, so rapid, then the cell is going to say it's too much. I can't handle it. It's too fast. So we're worried about the onset of the stress. We're also worried about the duration, not just the onset. So now outside, temperature is cold. Not freezing cold, it's cold. But if you stay outside for 5 minutes duration, nothing bad will happen to you. You stay outside for 5 hours. Now the duration went long. So now you see that the duration could be short. We love that, to have a short duration. That is better. But long duration of stress, that's gonna be a chronic problem. So rapid sudden onset is bad, while slow gradual onset is better. Short duration is good, while long duration of stress is very bad. The last thing is the intensity. So the intensity is, you have severe intensity, and you have severe intensity, and you have light intensity. Severe intensity meaning outside is cold. The intensity is pretty cold. If you go to the North Pole, now the intensity is even more hypothermia. So the stress there is more severe. So we don't like severe intensity, and we want light intensity. So what causes necrosis is these guys. The stress was so rapid and sudden. The duration was for so long, and the intensity was so severe, no time for apoptosis. It happened just so severe, so intense, and so long. Then the cell dies by necrosis. And you know what happens in necrosis? Everything, the plasma membrane, necrosis is ugly. Necrosis is very bad. Necrosis, you would have the membrane rupture, fragment, and you have all the internal. You have all the internal degradative enzymes, the acid, the reactive oxidative species, and the proteolytic enzymes, the metalloproteinases, all leaking out. The nuclear, the nuclear plant is leaking out to the nearby tissue. That's necrosis. But in positive death, apoptosis, we return right back to homeostasis. But here, and that's what we are concerned with in pharmacology. So in pharmacology, we are aware that there is a better, healthy route. If that was the case, we wouldn't need drugs, we wouldn't need medications, we wouldn't need pharmacological intervention. We need pharmacological intervention in the minus side. In the plus side is plus, so we don't need anything. So we're always going to be going down the minus road, minus, 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 minus. So we had stress, that's minus, that's bad. Then cell injury, that's minus, that's bad. Then cell death, that's minus, that's bad. And we know that cell death could be positive, that's plus, that's good, and we're gonna go back to building a new tissue. But now we're gonna assume the latter and the worst. We're gonna go in the dark direction. So now we're gonna see how the medication is gonna come in play. So then you're gonna move into necrosis, that's minus. Then after necrosis, you're gonna have acute inflammation. You're gonna have acute inflammation. Then after acute inflammation, you're gonna have chronic inflammation. Chronic inflammation. Then we're gonna have chronic inflammation. Necrosis, acute inflammation, and then we're gonna have chronic inflammation. That's minus, that's triple minus. Chronic inflammation is really worse. So now you see that all these diseases, lung fibrosis and all this disease, it didn't begin as chronic. It began with a spark, stress. Then it went to cell injury. Then it went to cell death. Then it went to necrosis. Then it went to acute inflammation. And if it lasts for longer than 3 months, then it becomes chronic inflammation. So you see, there's progressive steps that take us into that dark road of disease. Then you will see that's where pharmacology gonna come in. So inflammation you learned in you guys took anatomy and physiology. Don't tell me you didn't. You did not take anatomy and physiology. Did you guys take anatomy and physiology? So why you say no? Huh? So you take pharmacology before A&P? Are you taking it together? Oh, okay. So that makes sense. Okay. Yeah, you have to. Okay. So now you know in inflammation. In inflammation, you have redness. Redness. In Latin known as rubor. Then you have pain. Pain. In Latin known as dolor. Then you have swelling. Swelling. In Latin known as tumor. Then you have heat. Heat. In Latin known as calor. Then you have loss of function. In Latin known as functio lesa. Functio lesa. So you will see that the medications that you're going to take anti-inflammatory medications to help you with redness. So now to bring the redness down, you're going to take some anti-pain medication, the analgesics. So the analgesics, they're going to inhibit the cyclooxygenase pathway to stop the mediation of pain. So you don't feel the irritation of the nerve endings. So why you feel pain? You feel pain due to the irritation of the nerve endings. So now when the nerve endings get inflamed and you take this cyclooxygenase inhibitor, this analgesic known as Tylenol, is going to inhibit this enzyme so you will not feel the pain. So you see that you target, because the inflammation has, the table has 4 legs, inflammation has 5 legs: redness, pain, swelling, heat, and loss of function. So that's why you take anti-redness topical cream to bring down the redness. Then you take pain analgesic to target the pain. You're not done. You have the swelling. So you take diuretics to remove the edema and the swelling. Then you're not done. The heat. Then you put the cold pad so the heat can dissipate from an area of high heat to the area of low heat. Then the loss of function, you got to rehabilitate that injured region. So this is an example of how pharmacological inflammatory diseases get treated. You got to target these 5 and repair these 5. So the other class in the morning, I asked them question for extra credit. I was surprised because some of them answered it. This question is very interesting, and let's see now if you guys, I'm not comparing you to them, but let's see if you guys can come up with the answer. So far I told you in our pharmacological interventions, we target the disease based on how it comes. So we know that diseases are divided into inflammatory diseases. Okay, we have inflammatory diseases, and that I talked about already, that have pain, known as dolor. They have heat, known as calor. They have swelling, known as tumor. And they have redness, known as rubor. And they have loss of function, known as functio lesa. These are different aspects of the inflammation. But these are not the only kinds of diseases. Some diseases out there don't deal with, you have a disease, but it's not painful. You have a disease, there's no heat. You have a disease, no pain, no swelling, no loss of function, but you still have the disease. What is that? What's the other family of diseases that are not inflammatory? There's 3 of them. There is the inflammatory, there is the 2, that's number 1, inflammatory. Then we have a number 2. Then we have a number 3. Your friends from the other class figured them out. What are the two? Or maybe we work together. Actually, they got a couple of wrong answers, but from the wrong answers, they were able to come up with. So now give me anything I will work with. What do you think? I'm sorry? Hormone diseases. So hormone diseases is an end stage. So for example, when we say thyroid disease, what do you mean thyroid disease? There is inflammatory thyroid disease, then there is two thyroid disease and 3 thyroid disease. So what is the underlying? Yes, infectious. Did she say infectious? So when there is infectious, when you hear infectious disease, does an infection bring pain? Does an infection bring redness? Does the infection bring swelling, edema? Does the infection bring loss of function? So that's inflammatory. That's an infection, a stressful microbial infection that causes inflammatory cascade. So that's inflammatory disease. Bacteria is a microbial. So one of the microbe, you have virus, you have bacteria, you have fungus, you have worm, and you have a parasite. So these are all microbial, microorganisms that secrete endotoxin and secrete exotoxin to damage, cause necrosis and cause inflammation and cause redness, heat, swelling, pain, and loss of function. Yes, degenerative. So degenerative, when there is for example, degenerative disease in the spine, right? That's an example or no? Degenerative disease of the spine. Is that an example of? Okay, so one example of it. Then let's look at it.